Welcome to the Adversity Diaries. I'm your host, Carlos Jimenez, and in today's episode, I'm excited to introduce Dr. Edgar Vieira, a public health expert, physical therapist, and an all-around adventure seeker. From his groundbreaking work in injury prevention at Florida International University to his love for the outdoors and living life on the edge, literally, Dr. Vieira brings a unique blend of science and passion to everything he does. We will explore how his personal adventures and injuries have shaped his professional journey. Dr. Vieira, thank you so much for joining, and I'm really excited to talk to you and reconnect this way. I always, look up to you and everything you've done in your professional life, and now that I see you out there after your recovery from a major injury, which we're going to talk about, but you're doing a lot of things out there, so you're a testament of obviously working hard and going through difficult situations. So I'm really excited to chat with you.
Thank you, Carlos. It's a pleasure and an honor, and it's great to touch base again. And thank you very much for the opportunity.
No, awesome, man. So let's go. Let's dive into it. I know. I want to get to know you. Your upbringings, right? You have an impressive career. Focusing on public health, injury prevention, and rehabilitation. Can you tell us more about what first drew you to this field and how did you get into it?
All right. I grew up in Brazil, surfing and competing, and loved the ocean and the water, and was very interested in movement, and got interested in biomechanics, and that's mostly why I ended up going to physical therapy that had to do a lot with motion kinematics and biomechanics. I didn't know it was called that back then.
Exactly.
So I started, studying in that route, and then really was more interested in surfing than anything. But I got into a research, like an honors kind of program, got a little bit involved in research in ergonomics and injury prevention that really fueled my interest for that area. So after my undergrad in physical therapy, I pursued a master's degree and then went into a PhD and then, kept going, became a professor at FIU where we met years ago. And since I moved to Miami, there's not many waves here, not very often anyway. So I got more into kite surfing and other forms of ocean sports with rebadging, so it's been good.
Yeah. Awesome. Yeah, no, I really want to look into more what you've done outside of your professional life. But before we get into that, I obviously looking at your professional background and the research we did, your work addresses fall prevention and patient safety. What inspired you particularly to focus on that, and how do you see it impacting the future of healthcare? Big.
It could be a very long answer, but I started by getting interested on assessing motion and studying lumbar flexion extension, got interested in lumbar injuries and low back pain. So I did that in my master's, and then on my PhD, I moved to Canada where I was studying, lost time claims and work-related injuries in men and women. For women, most injuries happen in nursing with nurses during patient transfers. So while studying injury related to patient transfers in nurses, I got interested on the other side of the coin. So, okay, what happens if the nurse has an injury while helping a patient to transfer or lifting a patient and drops the patient? So I got interested in patient injuries and patient falls. So I did the postdocs studying, transfer-related injuries, patient falls, initially in hospitals, then in long-term care facilities. Then did some consulting for the healthcare system, then became a professor at FIU studying falls, moved into falls in the community with older people leaving their homes and falling, having to move on into long-term care facilities. Got interested in healthy aging, sarcopenia. So one thing led to the other, starting from surfing biomechanics to back pain, to injury nurses, to falls in patients, to falls in the community, to healthy aging. So it's kind of, one of those convoluted trajectories in life that keeps changing and keep things exciting.
Were you looking to falls in kite surfing? Not much, huh? Yeah.
Well, I learned to fall, so that's actually something good. I'm good at falling. So that may give me some edge later on. You fall in row or you fall in duck, and that's why kids fall a lot and don't get injured. But when a senior falls and they have delayed response times to protecting their face or not enough muscle to protect their joints, that's when injury happens. So learning to fall is very helpful. Look at skateboarders; they can have major falls and they're fine. It's very important skill.
Yeah, so I wonder, I mean, obviously you in the industry and leading this part of the science. So there's a lot of push about long-term health, right? Like, long-term health in different ways, aesthetics, cardiovascular, all these things. But where is I mean, you're expert in expertise in physical health. So where do you see that if you have to rank all the domains of health, what is the physical aspect in for you? Let's say nutrition, physical, mental, spiritual. Where would you rank those?
There's a misconception that those are different things. They're part of health. You cannot be mentally well and emotionally well if you're physically in really bad shape. And you cannot be physically in super good shape if your mental health is compromised. It's really hard to do one without the other. And you know what? Physical health is the low-hanging fruit. When everything is horrible, you can always go for a walk. You can always start with exercise. You can always start with your physical component, and that will start a chain reaction where you have hormonal changes, you have disposition changes, you have life perspective changes, and your mood starts to change. And then you're able to exercise more, and you add a little more endorphins there. And everything starts from somewhere. For most people, the physical component is the easiest because dealing with the mind and emotions and the traumas and the inner untouchable, untangible things can be very difficult. So I think start with the low-hanging fruit is a nice strategy. But for some other people, they're unhealthy, they're not fit, they don't exercise because their mental state is not good. So they need to start with some therapy, maybe with some changing diet that also changes the brain composition, the biochemistry. So it depends on the entry point to health, but health is a domain, and you have these different areas, and when you change one, affects the other. So it's all integrated. That's how I view the issue.
And that's very insightful. I mean, really, thank you for that. Do you think I mean, it seems like there's a lot of push for long-term health and prevention now in the U.S. I don't want to be stereotyping here, but I know in the past, the system is very resistant to that. Do you think that's evolving and changing?
I hope. That's what my whole work is for, because we talk about our healthcare system. But if you think about it, we don't have a healthcare system. We have an injury care system, a disease care system. That if you are injured, if you have disease, you go and get some treatment. And that's not cost efficient. That's extremely expensive. So what we really need is a true healthcare system which focus on diet and exercise, starting from the day you were born or even preconception with the mothers, right? Mm-hmm. So you have a lifelong trajectory of being healthy. And the system supports you to stay healthy. So you have a true healthcare system that the premiums of healthcare insurance goes down if you're engaged in an exercise program. If you can demonstrate that you have a healthy diet, your premiums go down. You want to have wind mitigation things in your home, your home care insurance goes down. We live in Florida, we know that well. You get more efficient appliances, so you're spending more in electrical. You get incentives, right? So why the healthcare industry is not going there yet? Some leading areas and insurances are starting to realize that, the other insurance industries are way smarter. You want people to be insured, but not use their insurance. So if you're a good driver, I track how you drive, and I give you a discount because you drive safely. So if you drive your body well and you're ingesting good foods, you're staying active, you're probably going to pay health insurance anyway, but you're not going to use it. Who benefits from it? Not only you, but also the insurance companies. Yeah. So when you change that mentality from trying to sell you a medication, trying to sell you exams, trying to sell you care, to the revenue source of getting paid for insurance and not having to provide service, that's when things will change.
Yeah. And are we really far from it, you think?
I think there's a change in mentality that needs to happen. Is a shifting paradigm from a consumer, economy based on you sell services, you sell physical therapy, you sell hospital beds, you sell medication, to, okay, there's another way of thinking of making money, which is not spending, right? We are all need to switch that. So instead of trying to make more money by billing more services, for example, for the health insurance companies, they can provide less service and saving on the policies that people that are paying and not using the services by staying healthy longer. It's the same way with us. When we think about, okay, I'm tight on money and I need to make more money. I need a job that pays more. I need a second job. Well, we need to rewire. Maybe if I spend less money, what can I cut with subscriptions, with eating out so much, foods that are not healthy for me, going for a walk and for a run instead of paying a $200 gym. You shift your mind from making more to spending less. And that starts with people, with industry, and with healthcare too, because it's based on selling medications, selling procedures, selling surgeries.
Mm-hmm. Yeah.
Right?
Have you seen this where I think some insurers are starting to do this, where they give you an Apple Watch now, and but obviously you have to prove that you have to hit so many steps throughout the day consistently for you to keep it or something like that. Is that something that you think it actually would change behavior, maybe?
That's exactly what we are talking about. You have these insurance companies for cars that put a sensor in your car and see how you drive. Same thing with this, right?
Mm-hmm.
And that's where if you can provide evidence that you're taking good care of your machine, then you're not going to have so much maintenance and care and certainly much more cost efficient. So that's the mindset. That's where I see things going. And this is not going to only be used for evaluating how you're doing and what you're doing, but this is going to be our ongoing doctor. Because when you go for a doctor visit, you have a one point in time view of what's going on. You do a gait analysis, you see somebody has a balance problem when they're there in the clinic. But if you have their typical movement patterns, their wake-sleep patterns, their O2 saturation, their heart rate, their activity and rest levels continuously 24/7, you can predict or identify when there's changes in pattern that indicate that are surrogate measures of some underlying issue going on with that patient, with that person. That may be a predictor of something is off. It might be you're starting to have postural hypotension, you're starting to be hyperglycemic and then having hypoglycemic episodes, and you're having postural hypotension, or there's something that is off on your system that might be a predictor of an adverse event, like a cardiovascular issue, a heart condition, imminent fall coming up, a stroke about to happen. So it can predict, identify, and intervene prior to an event happening. That's where my research is going actually now, is to try to create those predictors for preventing an event so that you don't have to treat it after.
Yeah. I mean, and, I'll give you a little insight. My background is sports medicine, elite athletes, working with the Olympic Committee and different elite sports professional environments. And I mean, obviously, this is a very small n or number of people that we're looking at, but we are trying to somehow do something like that, right? Where we have these athletes wear like Oura rings, and we have them come in once a week. They do jump on the force plates, and then they're tracking their, how many meters, how much movement they have on the field, all these things, which is great. But one thing that we were looking at, and I'm still curious. I don't know whoever's going to figure this out. Is like all these layers surrounding the athlete as a person can also lead to an injury that we cannot even measure right now. You know what I mean? So someone that has a stressful episode at home can also increase the risk of getting injury that we don't perceive it as a direct cause. You know what I mean?
Yep.
So it's so interesting. I mean, it's so many layers, but I'm really excited about your work, and I think we can spend so many hours of talking about this. I'm so into it about all this movement. Obviously, I'm a physical therapist, but I'm looking into learning more, and especially from people like you. But moving forward, talk about your Instagram, man. So we're looking at your passion about outdoor activities and adventure. How do those hobbies play a role in keeping your balance and energized for your work?
They are critical, right? I got involved in this area because I always liked movement, and I have a major passion and relationship with the ocean. Um, so when I grew up surfing, that was what fueled my life. Like that's all I could think of. That's when I look back on it, I think I was happiest was when I was in the water and sunrise, doing good waves with friends and laughing, and So it brings me back to that place. Now with kite surfing, I get up really early. Sometimes I'm waiting for the sun to rise to get out when it's windy. Like the hurricane 2 days ago, I was like, "Oh, come on, where's the sun? I want to go."
I saw your Instagram story, and it was hurricane after the day or during the day. Like that morning, you were already out there like 4 a.m. or something like that.
It was early. It was 6. Well, not 4, but it's still the sun only rising at 7 now. So like, come on, I'm ready to go. Where there's a little more light, and then a little more. So it's really exciting. It gets me pumped and kind of melts down the other worries. Like I think every person that really likes activity knows the feeling. When you get really excited, when the waves are really good, when the wind is strong, when the water's super clear for a dive, when the conditions are nice, you just get and that drive for life. Uh, and having those moments with that drive, with that excitement, really puts things in perspective of how joyful things can be, how excited you can be. It's like when you are a 7, 8 year old. I'm thinking about my daughter, and it's Christmas evening, and you're getting up in the morning, you want to saw the presents under the tree. That's that feeling. That's what drives life. That's what makes us want to keep going. We live for those moments. That's why we plan trips. We plan things ahead for that excitement period. We know everything are cycles, but it's kind of keeps things in perspective. And then I do my thing. I'm there from 6 to 8, and then I do my work, I do my papers, and everything goes fine. And that's what gives me the energy to do some of the things that are not so fun. Fixing bibliography and finding like stuff that you have to do that are not so exciting, but they become that much easier to do because and you have those hormones in your body, and you have something ahead, so you can get through the slower times in life, which are also important and inevitable.
I know personally, and I want you to share this. You've experienced an injury yourself, and if you can get your background of that, and how has that shaped your approach to rehabilitation? Because you're a PT by degree, and and helping others recover from physical challenges. So if you can give me the story background of your injury.
Okay, so 2.5 years ago, I went snowboarding. It was like late spring, like April 2022. And I went for a jump on a super big ramp, and it was slushy. So I came the right way, but I just didn't have enough speed. It kind of slowed me down the bottom of the ramp. So it kind of, my speed all got gone away when I went through that mud.
Yeah.
So when I went off the jump, I went high, but I knew I didn't have enough speed to cover the tabletop, the flat part before hitting the down slope. So I basically cased the landing, and I landed on a really flat area. with extended knee. So I fractured the tibia plateau, like it broke in pieces, and then both meniscus, and then ruptured the ACL, the LCL, the MCL. So there's not much left.
I mean, you have only one thing left hanging in there, I guess. The ligament.
So for the ligament, that's it, and the muscles, So
Bring me back to that. So you came back home, right? And how was like that rehab experience? You're at day one, first weeks of like the rehab aspect.
yeah, I was in Colorado, so I had to stay 5 days in bed before I could get on the plane and fly home. Um, and then 3 weeks after the injury, I did surgery, and I did ligament reconstruction, and put some cement on the bone, and did some holes to put new ligaments. Do that, and then I had to stay 3 months without putting my feet on the floor because they had to tie up the meniscus, and that's a little challenging, right? Because then when you're very active and you're in bed and you can't do anything, and and taking laundry basket on top of a skateboard, pushing with the you know with the with like, it's just not a fun thing. But it puts in perspective, because you're always telling people and patients, like, you know why you're so depressed, why you're so sad, you just have an injury, you're gonna get better, like just treating. But when it's yourself, you see how that affects your whole system, and it thinks like the world is ending. You're gonna get better. But it gives you perspective of that down, of being there, so you have a different kind of appreciation for what people go through. But the route. So it helps, the background helps. Okay, I know this. I know I know the stats. I know how things are gonna go. I know I'm getting the best care possible. I'm doing the most I can, and you keep driving. And the day after my surgery, I booked heli skiing trip for a year after. I said, okay, what I'm gonna do? I'm gonna book a heli skiing trip for snowboarding. A year from now, I'm gonna be on the snow. No, not a year. It was 8 months later, but the trip was for February. The injury was in April.
Okay.
So I booked it, and I said, okay, that's it. That's my goal.
Yeah.
I'm gonna get better. I'm gonna go on that trip, and then that's what I'm gonna do. So that
Did you ever have a doubt, like during the process? You're like, because things go up and down, but trending up. But there was a time moments that you're like, oh, I don't know if I can do it. Like the knee is not responding well, it's swollen, painful. Like, how do you cope with those moments?
it's hard. Like, they gave me, like codeine and all these medications. Said, hell no, I'm not gonna taking that. I know the epidemiology on those, and I know they're good. So I don't want to risk it, because I'm gonna get addicted to this stuff. I don't want to have it. So then you're in a lot of pain, and you question yourself if you are able to do that. And so then I did a lot of meditation. I did a lot of things related to my yoga training, and then did some meditation, some thinking, some inner work on the fears, and what is it that I'm so afraid of not being able to do it again? Why is that so important to me? There are other things I can do. So you go through all that exercise. What if I can't? Well, if I can't, I'll find something else. It's going to be fine. So you go through those up and downs, and you find a way, because there's no other way. There's no, when I was really sad or something, if I think, okay, I have a beautiful daughter, an awesome life, a great job, so many things to look forward to, and then you bring yourself to focus on what is needed, what I need to do, what I can do, and just don't think too much about the end game. Just think about what I need to do now. What's the best I can do now to give me the best chances of full recovery? That's all you can do.
Yeah, it's I had a patient the other day, then mid-50s, pretty active dude. I mean, in shape, everything, and he was like dealing with an injury. But then he's like, dude, I have it all, but the only thing I can think of right now is my health. Like, he had businesses, family, friends, everything, but the only thing he can think of at that moment in time, in that period, was his health. Nothing else matters at the point. Crazy.
So it puts things in perspective in what we really value, in what we care for. You know, why do we care? You know, you're caring about money, but if you don't have health, what are you gonna do with that money? You know what I mean? Like you put in perspective, like, okay, my mobility, my ability to do the things I love, that's the biggest thing I have. So it's not about longevity and living long, but living well and being able to do the things you want. If you're going to live miserable for many years, what's the point? So it puts in perspective the need for being independent physically, emotionally, so that you can perform and do the things you want and have joy and seek those moments, you know?
Yeah, no, I agree with you. I know people are gonna love this episode. I'm really liking it so much. But after you do everything you do, you juggle the research, teaching, funding for research, all these things. What's your favorite way to unwind and recharge? And I want to dive into literally, you like diving as well, right? You go into snorkeling. What is it about that experience that you're so drawn to it as well?
Yeah. Again, that we all have different elements that we seek: air, earth, water, wind, you name it.
Mm-hmm.
I find that connection with nature to be, surreal, to be the source of energy for me, with the animals in the ocean, with the water, with the wind, with the waves, the dynamics, the vibration. That energizes me and brings me back to that connection with myself, with the universe, with, almost a religion kind of approach to it, where you see the energy and you see the togetherness of the whole life and how beautiful it is. And that re-energizes me. So when I have a hard day, no matter what, I go do a little jump in the ocean, come back, find a few shells, bring home, and it brings me back to reality, to grounding, to see who I am and how beautiful this place and this experience we are having through this life it really is. So you always have to bring yourself back to that moment, to connect to that energy, to charge that battery, so you can keep going and keep trying, right? Because we're not always at our best, and that's what resets me. It's that I love free diving. I have friends that are teaching me that I love so much for the experience. And, paddle boarding, I paddle far away to different islands. I go to, up to Key Biscayne and back to Miami Beach. Like, I go free diving on the rocks and with friends, like, or snorkeling on the shore, looking for shells in 3 feet of water. I'm happy doing that.
Yeah.
Or do it.
Yeah,
Beach yoga, I do yoga. So it's like finding that connection, those moments where you centered again. And then you can perform well at work. So it's the other way around. People say, I don't have time to exercise. I don't have time to all this. How do you have time for all this? Well, I have to do it so I can do my work and be productive. If I don't, I have a really hard time. I start not being so productive. It takes me 10 times longer to do the same thing.
And how do you balance the challenge between your research world and like all the meetings that you have to do, and how do you strategize to manage such a diverse like workload and family as well, right? Like also, all the other things.
Yeah, well, I've been a professor at FIU for 14 years. Starting this year, I moved to administration. So I'm serving as the interim associate dean for research. So I'm transmitting my experience on how to do research, how to get funding, how to write papers to junior colleagues and assisting other senior colleagues with their projects too. So there's again a shift, a change in tasks, right? So I still do some teaching. I was teaching last week some of the research course that you guys hate.
Yes, statistics and all
Uh, but I think it was time for a change for me. So it's keeping changes and keeping things alive and keeping some things that are difficult to do, that are challenges. Because when the work becomes simple and easy, it kind of gets boring, right? And then it's day in, day out. And it's kind of, you're repeating your day again. And that's not living. That's not really exciting. There needs to be some components that are challenging. So sometimes I take too long to do things, and then I need to rush to get them done. And then I feel good that I was able to do that fast. So it's a personality thing, right? I need a little challenge.
Yeah.
And that's what keeps me going. So when things get too easy, it's time to change because I'm gonna get bored, right? So that you always need to find a little challenge. Switch the sports here. Take a different board, a different condition, different kite. Do research in a different area. My research is in many different areas. That's because sometimes I get too much into one area, then I say, I need to find something a little different. I spice it up with technology. So, that I think that's the secret for longevity at work as well.
Yeah. Yeah. No, that's very insightful. I feel like a lot of people can relate to this because we all go through that cycle of learning curve, and you're like excited about everything. They're like, okay, I think I learn it, I master it, and then now I'm like, okay, what am I doing with my life, type of thing. And you have to feel like you have to reinvent yourself a little bit, no? Like
Yeah.
rediscover, rekindle what actually drawn you to do that at the first place, and then try to like find ways to approach your life in a different way. But so insightful for that. So going back to your public health work, injury prevention, what do you see as the most important steps we need to take to improve patient safety and rehabilitation in the coming years?
Is to have less patients first, to invest more on prevention, to reinvent the healthcare system, while to create a healthcare system from the injury care system we currently have. How people realize that the basics are always true. Diet and exercise work. There's no replacement. We try to look for the pill, for the treatment, for this, for that. But if you eat well and move more, that's the start for everything. And they take small small steps towards increasing your levels of activity, towards improving your diet that are sustainable. So we move away from talking about diet and exercise, and we start talking about eating better, moving more.
Yeah.
Because we can always eat better, a little better. You can always move a little more. But if you do a diet, you're going to quit. It's a diet. It has a start and an end date. You don't live your life on a diet unless you want to be miserable. You don't say every day, I need to exercise. You're going to go exercise. You say, I'm going to move a little more. I'm more physically active. You can spice it up and change what you're doing. It's even good for your musculoskeletal system. You're not always doing the same thing. You mix up some stretching with some strengthening training, with some aerobic exercise. Mix and match. Try Pilates, try yoga, try weightlifting, try Zumba, try you name it, right? So eat better, move more, do a little more every day. Once that gets integrated in your lifestyle, you add a little more, and you add a little more. That is sustainable. Because going through these cycles of diet and exercise, starting and quitting, it's unhealthy, right? So that way you can do this integration of behaviors in your lifestyle with the small changes, drinking a little more water every day, eating a little more beans instead of meat, or, slow, small changes in the quality. Get up and sit down if you're watching the news or a telenovela or whatever you like to watch on TV, or Netflix or commercials or something. Sit and stand 10 times in between on the interval when you get an ad, or when do a little more here and there. If it's just one or two floors to go up, take the stairs. Small things. I think that's what it changed public health.
Yeah. And then, okay, I'm gonna have a follow-up question to that. So, where do you see you were a PT, so you understand the industry a little, obviously. And how do you think PTs can ignite that in patients and public health? Can we be the drivers of that movement?
We should. Well,
We should.
first thing, I haven't been a PT in over 20 years, right? Because I did my undergrad in PT, and then I went into research because I want to do prevention. And there's no way to do prevention as a PT because there's no reimbursement for prevention.
That's a limitation, huh?
Right? That's the limitation that drove me back then. That's what I'm talking about now, 20, almost 30 years later. So the thing is that I don't do patient care. I work with prevention programs, exercise and diet, mostly turned into research, right? To prevent sarcopenia, functional decline, physical decline, a loss of muscle mass, falls, frailty, hospitalizations, long-term care admissions. So as we work in this injury care model system we have. But imagine if we change, we say we're physical therapists. We treat the physical, the healthy physical too.
Yeah.
So we become promoters of health. So you have your yearly physical exam with the PT to see how you're doing, how you were in the beginning of the year or a year ago, how you are now as far as gait speed, quad strength, grip strength. Okay, look at your pattern, look at the normative data for your age group. Oh, you need to exercise a little more. And you start giving people advice. Oh, you're getting, you have shortening on your muscles. You need to do a little more stretching. Or your cardiovascular system is not so well. You need to do more aerobic exercise. Or you're hitting 40, do more weight training. Do more strength training to keep your muscle mass and your hormonal levels adequate. So PTs can play a huge role on prevention of functional decline, of physical decline. And if you convince the healthcare system, the injury care system, that there needs to be a healthcare system and pay for us for our healthy visits with PTs so that we treat not only people that are with injuries, but everybody to remain healthy. That is a major benefit for the population, but also for PTs because your sample of potential clients go from people with injury and diseases and that are not well to everybody because everybody can benefit from advice from experts in health, in physical health.
Yeah. If it will only be reimbursed, if it only will be reimbursed, that's the main limitation that I found. Mainly because we try to do this, however, but then it's gonna be out of pocket, right? And a lot of people don't have the means, unfortunately, to do it. But I think there's ways. I think the clinics that want to do it right, I think there's ways you can maximize, the business size with ethically providing the best care for the health and longevity as well. So, I mean, we'll hopefully that changes one day because I'm just it's frustrating for a PT myself that I need to only see people for you have some type of pain, discomfort, but then the person has some metabolic syndrome, underlying issues, and you're like, okay, so I know if I only treat your knee is only a small part of the issue. We have to treat you as a whole because that might be a result of everything else. Your knee pain is a secondary to whatever is happening inside yourself. So it's a very difficult situation that I hope one day, maybe I don't know if it's me or the next generation that can actually take the benefits from all of this, but one day we'll get there. What's next for you? Any exciting projects or research initiatives you're particularly excited about?
Yeah, what I'm doing now, one of the things I'm doing now is looking at, like I said, using smartwatches to look at typical patterns 24/7 and then using machine learning and artificial intelligence to identify patterns and changing patterns that may be associated with health outcomes. Trying to predict falls and create a false prediction tool that alerts people and healthcare providers and family members when somebody is likely to have a fall within 3 days. Trying to identify leading indicators of cardiovascular disease, diabetes, cancer, and other things affecting the body that might be first identifiable through changes in typical behavior using wearables. So that's one. I have another project looking at premature aging among first responders from 9/11 that moved to Florida, looking at how that experience affected their longevity and their quality of life at later age as they moved to Florida. And that's another one. Also, the people taking the medications, the cocktail for HIV control, they have some indication of premature aging as well related to the medication because that became a chronic condition. So they're living longer, but the side effects of the medications are leading to these premature aging things. So how can we support this group and identify and control the side effects of the medications? So those are some of the projects that I'm working on. I'm working some groups in Brazil, in Canada, in Norway on falls prevention programs as well. What else? Looking at effects of yoga on different muscle groups for experienced and newer practitioners. What percentage of muscle contraction we are getting, the different postures, variability. Well, we can talk for a while. That's some of the projects I've been working on.
Definitely, you that keeps your brain juices going, no? That's why you need a little bit of different industries there, but that's cool, man. So we have this segment here. It's called rapid fire round. Okay, so about 3 questions, gonna ask 3 or 4, and just pick and choose which. You just tell me what to do. Okay. So one book or research paper that inspired you recently.
Blue Mind. Blue Mind talks about the neuroscience behind why living by the ocean or being in contact with the water, how that affects the human brain, happiness, longevity, quality of life. It explains what I'm so driven to water. So it resonates a lot with me.
Wow. Oh, speaking of that, have you heard these people like live close to the ocean and they can hold their breath on the water for like minutes just to I don't know their name. This is specific natives of the region. Yeah, those. Do you know them? Yeah. It's insane.
There's the pro hunter women, in Indonesia, in China. There's some other divers in Fiji that stays up to 7-8 minutes underwater, which is pretty crazy. But those are adaptations. You reduce your heart rate, your metabolism. It has a lot to do with meditation and being alpha level, kind of alpha state. The brain itself reduces the need for oxygen, and the heart rate goes down once you're submerged. So there's some very, very specific physiological changes that happen underwater. But it's super awesome science behind what the physiological mechanisms to be able to do that, which is super cool.
Nice. All right, morning person or night owl?
I think you'll know that one after our talk.
I'll say morning person.
Or just that person, yes.
What's your go-to recovery method after a long day of work or research? I think we know this one too.
Ocean. Yeah.
There's ocean. Nice. All right, next. Would you rather focus purely on research or teaching the community about your research?
Research, especially researching my next trip.
Nice.
But yeah, though, I think, though, jokes aside, I think the research it drives me a lot, my excitement. But there's no point in doing research if you don't share the findings. So also going to conferences and disseminating the findings of research, it's super cool, and I get really fired up about doing that as well.
Cool. Would you rather work with technology-driven healthcare or hands-on treatment? I think I know this one, but when I hear
well, I work with technology in healthcare right now, and that's where I see things going. Hands-on treatment will never be replaceable. There's no AI for that.
Yeah.
But I'm not a frontline clinician. I love to do hands-on care for friends and family. I can't call care, otherwise I get in trouble. But I love it, and I have the skills, and I have learned, and I love to share what I know and provide care, hands-on care, and energizes me too. Those both have their places, but professionally, what I do is more technology oriented.
Cool. All right, last question here. Moment of Zen. What's one piece of advice you hold onto when the goings get tough?
I remind myself that life is a hilly road, right? It's not a straight path. Things go up and down, and when you have tough times and when things are not so great, I remind myself, look, you've been there before and you're gonna be there again, and things will get better. Just hang in there, do what you need to do to get through this little hill, little bottom here. And when the further down you are, when you're at the very bottom, there's only one way to go. So you just know you're gonna go back up and things will be fine. I need to always remind yourself. And I think it's especially important to remember that that's the nature of life when you're up. Because when you're on the top and you're all happy and excited, right? You think that will last forever. It won't. It's going to go down again. So remind yourself, enjoy every bit of this little break you're getting and work hard to sustain for as long as you can, because going downhill is easy. When you realize you're going down, you need to. So noticing and realizing that cyclic nature of life, of good and bad times, of, cool, fun, and difficult periods is essential for both ends of the spectrum, because that's the road we're in. It's never linear.
Cool. Wow. There you have it. Thank you so much, Dr. Vieira. I think it's been a really insightful talk. I really, one day, we'll have to sit down and get coffee and go to the ocean and just enjoy life there. Thank you so much for your time. We really appreciate everything the work you're doing. First of all, I think it's impressive. We need more people like you to look and for long term and longevity and helping people now to live longer, if possible, enjoy life. And I'm really excited to what you're gonna push out from your research. And thank you so much. We appreciate it, and thanks for all the insights.
Thank you, Carlos. Always a pleasure. Hope to see you soon.